Greetings. I'm Amy Ronshausen, and I'm the Executive Director of DrugFree America Foundation. DrugFree America Foundation is a national and global drug prevention and policy organization committed to developing strategies and educational programs that prevent drug use and promote sustained recovery. DrugFree has been committed to following the vision of our founders, Betty and Ambassador Mel Sembler, cultivating a world where people can live free from the burden of drug abuse, forging a path to push back against drug normalization, and focus on promoting and implementing strategies that reduce illegal drug use and addiction. The organization was established in 1995 at a time when the world was trending in a new and dangerous direction. Drugs were being glamorized in music and popular culture, and drugs like heroin, methamphetamine, ecstasy, and marijuana were becoming cheaper, more potent, and easily available to children and young adults. Those working in prevention knew that left unchecked, spikes in drug use, abuse, overdose, and deaths were inevitable. Our organization's leadership knew that a multi-pronged approach was critical to begin addressing the dangerous trend of illegal drug use, not only in the US, but worldwide. Within the first 5 years, DrugFree launched the Institute on Global Drug Policy and the International and Scientific and Medical Forum on Drug Abuse, two important forums to address drug use and addiction. In recognition of our work, DrugFree received special consultative status to the Economic and Social Council of the United Nations, allowing us to strengthen our voice and participate in global discussions, decisions, and strategies related to drug demand reduction. As Executive Director, I'm proud to say that more than 25 years later, the organization remains committed to developing strategies and educational programs that prevent drug use, increase access to care, and promote sustained recovery. One of our long-standing divisions is the National Drug-Free Workplace Alliance, or NDWA, whose mission is to be a national leader in the drug-free workplace industry by directly assisting employees and stakeholders, providing drug-free workplace program resources and assistance, and supporting a national coalition of drug-free workplace service providers. This is accomplished through directly assisting employers in assessing their workplace and establishing a comprehensive drug-free workplace program that includes a written policy, training and education for supervisors, employees, and parents, drug testing program enrollment, employee assistant program referral, and support to employees seeking treatment or for those who are in recovery. Training is a key component to a successful drug-free workplace program, and DrugFree has developed online courses for both supervisors and employees. These trainings are applicable to both small and large workplaces and meet the requirements for those regulated by the U.S. Department of Transportation. As frontline leaders, supervisors are trained in how to recognize the signs and symptoms of substance use, how to document those indicators and related performance issues, and how to intervene when necessary. With the supervisor support and understanding of the program, both employees and the employer will benefit more fully from the overall drug-free workplace program. Educating employees allows them to fully understand their workplace program and how substance misuse has a negative impact, especially where safety is concerned. This division offers a membership that empowers workplace safety, wellness, and recovery. It lets employers unite with other employers and stakeholders to share a strong, unified voice in pushing back against the harms of drug and alcohol in the workplace. It also allows DrugFree America to advocate on members' behalf to preserve and strengthen employer rights to maintain a healthy work environment that promotes prosperity for all. Services included through this division are written drug-free workplace policy and supporting forms, assistance in policy implementation and assessing insurance documents, drug testing setup at affordable rates, online training courses for supervisors, employees, and working parents, employee assistant program referrals, news and updates on related workplace issues, and consultation with our staff. DrugFree has produced a variety of workplace webinars and resources over the past years that focus on substance misuse topics affecting the workplace. Some of the webinar programs include impacts of marijuana and opioids on today's workplace, identifying impairment, stigma in the workplace, and recovery-ready workplaces. In partnership with the Colombo Plan and with the support of the Bureau of International Narcotics and Law Enforcement Affairs, DrugFree America was able to expand our reach in this area by creating a training entitled Establishing a Drug-Free Workplace. This training is part of the Universal Treatment Curriculum for Substance Use Disorders. This training has been provided at the ISIP conferences, both in Kenya and Austria. To keep informed on drug-free workplace programs and related news, data, and research, join the Drug-Free Workplace Working Group on the ISIP website. A growing division of the foundation is our global force. Previously known as the International Task Force on Strategic Drug Policy, the Global Task Force is a network of professionals and community leaders from across the globe who support and promote effective drug demand reduction principles and strive to advocate communication and cooperation among non-government organizations who are working to stem illicit drug use and promote sound drug policies around the world. Members stay connected via monthly newsletters, quarterly virtual meetings, and in-person meetings when possible. These meetings reinforce effective demand reduction principles and programs and enable attendees to mobilize their communities to push back against substance abuse and efforts to legalize drugs. The trainings bring together key decision makers who advise governments, intellectuals, researchers, doctors, and other community leaders. It is important for NGOs and civil society individuals to have the ability to advocate for ideas and policies that are meaningful and of interest to them. There must be a strong voice for evidence-based prevention, treatment, and recovery strategies. Drug use can be prevented, addiction can be overcome, and recovery is possible. We must work toward these goals. The task force enables greater participation in events hosted by the United Nations Office on Drugs and Crime, such as the Commission on Narcotic Drugs. We are committed to building the capacity of civil society at these global meetings and committees, such as the Vienna NGOC. At events like the Commission on Narcotic Drugs, we collaborate with global partners to sponsor and co-sponsor side events. At the 65th session of C&D, we partnered with NGOs in the US, Turkey, and the Democratic Republic of the Congo to host an event on drug-endangered youth, and co-sponsored events on recovery and reducing stigma with partners from the UK, Italy, Bosnia, and one on the risks associated with cannabis commercialization with partners from Europe, Asia, Africa, and America. One way we can give a voice to working programs around the globe is through our newly established podcast called Pathways to Prevention. The podcast is a collection of interviews conducted with experts in substance use prevention, treatment, and recovery. Highlights to date include school-based prevention programs in Afghanistan, building recovery capital in Macau and the Balkan regions, the realities of marijuana legalization in the Americas, and gender-based strategies for women and girls, and much more. Search for Pathways to Prevention where you listen to podcasts and contact us if you'd like to be our next guest. We would love to highlight your program success stories. DrugFree America produces educational campaigns on trending drug demand reduction topics that include short animated videos and resources such as one-pagers and infographics. These campaigns are pushed out through cross-platform digital marketing and are free to use and can be co-branded. We currently have a series of 4 high-quality videos that are marketed in the US and in targeted countries worldwide. Collectively, the videos have garnered more than 13 million impressions and drove over 100,000 viewers to our website. The video series were accompanied with static resources focused on the following topics: the environmental impacts of drugs, the impacts of drugs in the workplace, protective factors, and alternatives to incarceration. Building and enhancing protective factors with youth is always an important focus for prevention, but even more so during the pandemic. Understanding protective factors and how to build strong, healthy children and families can help prevent kids from experiencing adverse childhood incidences and initiating into substance use. This new video and resources raise awareness on prevention and provides tips on fostering drug-free youth and families. Let's watch this popular video campaign.
Around the globe, 35 million people suffer from substance use disorders. Not surprisingly, most of them started using as adolescents. And while there are certain factors that increase the risk of developing a substance use disorder, there are many other factors, starting in childhood, that can actually reduce the risk. These protective factors are characteristics within children or their environment that enable them to successfully manage and adapt to life's challenges. Being a fully engaged parent begins with being a role model for your children. Communicating well with kids and their teachers, plus staying closely involved in school activities and homework really pays off. Children tend to earn better grades, develop better social skills, and partake in healthier activities while avoiding more risky behaviors. With the onset of adolescence, young people become more independent and more likely to be influenced by peers and others outside their family, which adds up to a greater chance of being exposed to drugs and alcohol. So, it's critical that parents become educated on the subject and have family discussions on the dangers of drug and alcohol use. Be sure to carefully monitor your children's friends and activities as well. Plus, setting clear rules along with firm discipline goes a long way in helping them avoid risky behaviors. Keeping teens focused on healthy activities such as sports, youth clubs, or volunteering will also keep them on a safe path. Remember, children not only listen to what adults say, they watch what we do. As a parent, one of the best things you can do to prevent young people from using substances is to set a good example yourself by avoiding the use of alcohol, drugs, or tobacco within your home. We can all play a role in building protective factors for young people by adopting healthy habits, setting clear boundaries, providing encouragement, and by simply listening. For more information about building protective factors, visit DrugFree America Foundation at DFAF.org.
To supplement the video, DrugFree created a resource for adults as well as one for youth. This is the adult resource, which can be found on our website, download it, and co-brand it at no cost. Our youth-focused resource was created in partnership with local teens who brought to our attention that it's not only adults who can build and enhance protective factors, but youth play a very important role in doing so with their peers. Policies that allow for alternatives to incarceration are a way to link individuals with substance use disorders to supportive treatment and social services. DrugFree's Alternatives to Incarceration video informs viewers that this proven approach can increase the number of people in long-term recovery and keep families together while reducing crime and recidivism.
There's a worldwide epidemic crippling the social and economic underpinnings of our society. An estimated 35 million people suffer from substance use disorders, which experts consider to be a chronic disease. As such, when drug abuse leads to other crimes, it's often better addressed with rehabilitation rather than incarceration. These alternatives to incarceration can effectively address the needs of people suffering from addiction by providing supportive treatment and social services, often leading to a reduction in crime and recidivism, along with a reduction in the public health and safety consequences associated with drug use. Other benefits include helping to keep families intact, breaking the cycle of addiction in children, and having a profound effect on reducing racial inequity. Instead of following traditional procedures like booking an arrest in drug abuse cases, deflection programs allow law enforcement or first responders to employ evidence-based risk need screening tools to make referrals to community-based drug treatment and mental health services, allowing those involved to avoid the consequences that come with a criminal record. Drug courts are another alternative to incarceration, requiring treatment, supervision, and community support. Compared to other offenders, participants in drug courts are less likely to reoffend and less likely to test positive for drugs. So, what's the bottom line with these alternatives to incarceration? They can increase access to care for individuals with substance use disorders, decrease the burden on the criminal justice system, and establish support that leads to long-term recovery. Plus, research shows that sending drug and alcohol abuse offenders to treatment programs rather than incarcerating them will actually cut crime rates and save billions of dollars. For more information about alternatives to incarceration, visit Drug-Free America Foundation at DFAF.org.
In addition to educational campaigns, Drug-Free America produces one-pagers and infographics on current topics related to drug demand reduction. Recent topics include the impacts of marijuana legalization, recovery-ready workplaces, stigma in the workplace, apps every parent should know about, vaping, and behavioral health equity. Anybody can download these resources from our website and many more. These resources can also be used in the community, on social media, and as advocacy tools when meeting with policymakers. On our website, you will also find our research blog that distills complex information and presents it in an easy, accessible, usable format. This is a vital exercise as it allows many groups that we work with to easily share information with their networks and community stakeholders. Topics include highlighting research identifying marijuana trends, the harms of marijuana on pregnancy and future offspring, strategies to address the opioid crisis, stimulant abuse, as well as the effects of COVID-19 on substance abuse treatment and recovery. This year, we are excited to announce that we will be conducting 2 new research projects. One will be related to impaired driving and traffic fatalities, and the other one will be related to the impacts of high-potency THC products on youth, especially mental health. Drug-Free America participates in many local, national, and global meetings and conferences by providing presentations, technical assistance, and/or sponsorships. For the last decade, Drug-Free has hosted an annual prevention summit in Florida. The purpose of the summit is to raise awareness on the impacts of substance use, enhance knowledge of how to reduce access, change social norms, and encourage discussion on current research, trends in use, and policies. At our 9th annual summit this past August, we were excited to welcome back nearly 250 attendees. The summit featured experts in the field of national drug demand reduction, including the Florida Attorney General, the Acting Director of the White House Office of National Drug Control Policy, and the Deputy Director of the National Institute on Drug Abuse. Topics that were covered include lessons learned from marijuana commercialization, building cultural intelligence and prevention services, trends in stimulant use, adverse childhood experiences and substance use disorders, transnational criminal organizations and drug trafficking trends, and much more. Our social media presence is ever growing. Between Facebook, Twitter, and Instagram, and our YouTube channel, we have almost 100,000 followers. Connect with us on our social media channels to share resources, research, and news on upcoming events. Our door is always open to ideas on how we can better collaborate with our global and local partners. We are so grateful to be part of this drug demand reduction family, and we look forward to connecting with you virtually and in person. Thank you.